So we have 3 reporting periods for today's update. Friday to Saturday, we had 9 additional cases test positive for COVID-19. Between Saturday and Sunday, we had 15 people who tested positive, and Sunday to today, an additional 7 people. That's a total of 31 people who have tested positive for COVID-19 since Friday, bringing our total in British Columbia to 2,978 people. That includes 1,008 people in the Vancouver Coastal Health Region, 1,570 people in Fraser Health, 132 people in the Vancouver Island Health Region, 203 people in the Interior Health Region, and 65 people in the Northern Health Region. We have no new healthcare outbreaks. We remain with the 4 active outbreaks in the healthcare system, 3 in long-term care and 1 in acute care. We've had an additional 11 new cases in those facilities, 2 of whom are residents, bringing the total to 393 residents and 246 staff who have been affected with COVID-19. So we currently have 166 active cases, of whom 16 people are in hospital, 4 of whom are in critical care or ICU. Sadly, we've had 6 people who have died over the past 3 days. 4 in the Vancouver Coastal Health Region, all of them in long-term care, and 2 in the Fraser Health Region, one of whom was a person who passed away earlier in June at Langley Lodge, but the death in review has been attributed to COVID-19. So this brings our total a number of people who've died. Actually, I don't have the total in front of me, but we want to pass on our condolences to all of those, particularly the families of the people who have passed away over the last few days. As always, this is such a challenging time to have a loved one pass away, and we know that they are mourned by their family, by their caregivers, and their communities here in BC. We have 2,629 people who have fully recovered from COVID-19. As you know, over this past weekend, things have been progressing in terms of our new normal, and I know many of us have found many more people out on the streets enjoying the weather that we have here in BC and the many activities that we can do safely right now. But importantly, we are following the rules that we have established for those safe social interactions, the rules that are our foundation to be able to keep our economy going, to keep our social interactions going, to keep our businesses. And as we have seen, these new normal rules are very doable. We can live with these. Young or old, in the city, a small town, we can all do and must do the right thing. This means leading by example, like we have been doing in BC since the start of our pandemic, assuming the best in those around us. As we have seen an increase in the number of visitors from elsewhere in Canada in these last couple of weeks, many businesses who rely on visitors and tourism have retooled and put together safety plans to allow them to open the doors to other Canadians. And let's show other Canadians how they too can do their part when they're here in BC. Anyone who is new to British Columbia from elsewhere in Canada, whether they're coming for work or on vacation, needs to understand that here in BC, we are keeping our bubbles small. We're having smaller numbers of people that we're gathering with. We are maintaining our safe distance from others, whether it's in a store, on transit, or in our community. Using masks when it's challenging to maintain that safe distance, and always, always staying away from others and staying home if we're feeling ill. Anyone from outside of Canada who's here for essential travel or is returning home is required to follow Canada's quarantine order to self-isolate for 14 days prior to interacting with us in the community. And while this quarantine order is an important part of Canada's border protection, we remind all British Columbians to show kindness and understanding to those around us. We have to remember that many Canadians reside elsewhere, and many of them are only now returning home. Many have returned home in the months since this pandemic started. So let's assume the best, and rather than offering judgment, continue to do what we have been doing with kindness and compassion. COVID-19 has created many, many uncertainties and fear, but we have built a path forward in British Columbia that will keep all of us safe in the weeks and months ahead. And we need to keep that balance so that we can continue to have visitors to our long-term care homes, so we can continue to go to restaurants, we can continue to meet with each other. And through our own personal efforts and actions, we can protect our communities, particularly our elders and seniors who we know are more vulnerable, and our loved ones. We are in this together, but our public health teams are monitoring and managing all of the new cases that we have in BC every day, making sure that we have all of the contacts, and we are doing our bit by minimizing those contacts that we have so that we can modify as we need and how we run our businesses, how we spend time with others. We've worked hard to flatten our COVID-19 curve in British Columbia, and by continuing to stay vigilant, to follow our foundations and work together, we can continue to keep our communities, our families, and our province safe. And in doing so, let's remember to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. And this is obviously a very somber day for us. 6 people are announcing the deaths of 6 people from COVID-19 in BC over the past 3 days. And one of them, as Dr. Henry has said, is from earlier in June. But we know the price that COVID-19 has taken from us as a whole community. We know and can identify that in many ways. But to lose 6 people all in long-term care over the last 3 days is a source of enormous grief for the families involved, for the caregivers involved, for the communities involved. And we share that sense of loss, that sense of grief with them and with the 183 people and their families who have passed away from COVID-19 since the beginning of the pandemic in British Columbia. It is a moment, I think, of sorrow for all of us, and we want to make sure that that sorrow is felt, because I know people feel it throughout the province, for all those families who have lost their loved ones. I wanted to say that there, as noted, 16 people in hospital, 9 in Fraser Health and 7 in Vancouver Coastal Health, and disproportionately in Fraser Health. They're part of the outbreak at Mission, at the Mission Memorial Hospital. Obviously, we are those are being monitored very carefully, and I think on the question of long-term care, and I wanted to speak briefly about family visits in long-term care, that on the question of long-term care, that continues to be an ongoing concern for all of us and everyone in the healthcare system, all those people, all those families who are struggling and are dealing with the situation at Holy Family and at Mission Memorial and at other care homes in BC, all those who have felt the anxiety that comes with an outbreak being declared, whatever its size, since the beginning of this pandemic. We're thinking of them and continuing to be concerned about the outcomes for everyone in long-term care. As you know, last Tuesday we announced updated requirements with respect to long-term care and social and family visitation. Health authorities are actively engaging with operators to support them in the development of plans in accordance with the requirements of the policy, so that visits can occur in long-term care homes. It's expected that the majority of operators will submit their plans to health authorities this week, and that social and family visitation for most of those facilities will start next week. It's important to remember that visitation may start sooner, as early as this week, as early as they are coming days in some facilities and later in others, depending on the work required at each facility to meet the requirements. Visits, of course, must be scheduled in advance, and operators are required to maintain a list of visitors and their contact information. I'll have more information on Thursday on the progress that facilities and health authorities have made on this important issue, and we'll have that on Thursday, including the number of plans submitted and approved. As I usually do on Monday and Tuesday, I want to bring you an update on PPE. In particular, as you know, as we do as of last Monday, June 29th, we had procured since the end of March 5,933,095 or equivalent respirators, 22,300,000 surgical or procedure masks, 2,301,000 pieces of eye protection, almost 50 million pairs of gloves, and over 2,825,000 gowns. This week and the week since last Monday, June 29th, we've received the following: 15,342 N95 or equivalent respirators, 516,250 surgical or procedure masks, 3,665,250 pairs of gloves, and 114,160 gowns. We'll continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective product for our healthcare system. And finally, just in closing, as you know, on June 24th, Premier Horgan and Dr. Henry announced our transition to our phase 3 of our COVID-19 response. And as we start the third week of this transition, one guided by science, prudence, and care, our commitment to stopping the spread stands. We know that physical distancing saves lives. We know that bending the curve, not the rules, has brought us to this point in our social, surgical, and economic renewal. We know that in our individual and collective BC effort with COVID-19, we made the difference. We also know that this continues to be with us in communities. 31 cases over 3 days, but people also, 6 who have passed away. And it reminds us of how we are all linked in dealing with COVID-19. It's that linkage, that coming together, that work of everyone in the community that has brought us to this point. So is staying 100% all in on our BC COVID-19 response. And this summer, our effort must continue this day and every day, no matter where we are in BC and no matter where anyone else is, anywhere else in the world. This summer is a welcome chance for all of us to catch our breath, to recharge and renew ourselves. By staying 100% committed to stopping the spread, we give the peace of mind and calm we seek and that we need in this period where we have this enormous challenge before us. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 3 et 4 juillet, celle des 4 et 5 juillet et celle des 5 jusqu'au 6 juillet en mi-journée. Nous sommes attristés d'annoncer 6 nouveaux décès liés au COVID-19 dans le région de santé de Fraser, 2, et de Vancouver Coastal, 4, pour un total de 183 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. À ce jour, 2629 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, qui s'étend jusqu'au 4 juillet, nous avons eu 9 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 5 juillet, nous avons eu 15 nouveaux cas. Au cours des dernières 24 heures, 7 nouveaux cas se sont ajoutés pour un total de 2978 cas en Colombie-Britannique. Thank you very much. Merci beaucoup. We're happy to take your questions.